Which one of the following statement is incorrect about Glasgow Coma Scale? Option A. The scale measured the neurological status. Option B. Sensory responses are easily assessed. Option C. The maximum score is 15. Option D. A score less than 8 indicate coma. The correct answer is option B. The sensory responses are easily assessed. In which one of the following conditions Kernig sign is considered as positive indicator? Option A. Meningitis. Option B. Hepatitis. Option C. Deep vein thrombosis. Option D. Typhoid. The correct answer is option A. Meningitis. Kernig sign is the one of the physically demonstrable symptoms of meningitis. Severe stiffness of the hamstrings causes an inability to straighten the leg when hip is flexed to 90 degrees. Which one of the following is the most potent stimulus for erythropoietin production? Option A. Anemia. Option B. Proteinuria. Option C. Hypoglycemia. Option D. Hypoxia. The correct answer is option A. Anemia. One of the major complications that occur during hemodialysis is option A. Muscle cramps. Option B. Hypotension. Option C. Air embolism. Option D. Pulmonary edema. The correct answer is option B. Hypotension. Common complications of hemodialysis are hypotension, cardiac arrhythmias, nausea and vomiting, headache, fever, back pain. Less common complications are air embolism, seizure, hemolysis, severe dialysis disequilibrium, acute urticaria, cardiac tamponade. The let-down reflex during breastfeeding is influenced by the hormone. Option A. Progesterone. Option B. Estrogen. Option C. Prolactin. Option D. Oxytocin. The answer is option D. Oxytocin. Let-down reflex is term used to release of milk into the mother's breast duct in response to the baby suck. Suckling stimulates the sensory nerve fibers in the nipple, send impulses to the hypothalamus, which order the posterior pituitary gland to release oxytocin into the bloodstream. Cells surrounding the outer wall of the alveoli are stimulated to contract, eject milk into the duct. The milk released or let down through the nipple. Effect of nicotine will increase the body's secretion of option A. Thyroxine, option B. Epinephrine, option C. Pancreatic juice, option D. Histamine. The answer is option B. Epinephrine. The nicotine absorbed in the bloodstream and goes to the adrenal glands. The adrenal gland release adrenaline or epinephrine. It increases the blood pressure, breathing and heart rate. Therapeutic effect of digitalis is to option A. Dilate coronary arteries. Option B. Decrease electrical conductivity of the heart. Option C. Decrease arrhythmias. Option D. Strengthen the heartbeat. The correct answer is option D. Strengthen the heartbeat. Therapeutic effect of digitalis is strengthen the force of heartbeat by increasing the amount of calcium in the heart cell. Calcium stimulates the heartbeat. When the digitalis reaches the heart muscle, it binds the sodium and potassium receptors. These receptors control the amount of calcium in the heart muscle by stopping the calcium from leaving the cell. As calcium builds up in the cell and it causes the stronger heartbeat. Example of digitalis is digoxin, used to treat heart failure atrial tachycardia, atrial fibrillation,